The first is myocarditis, or the inflammation of the heart, which has been spoken a lot about recently. And I wonder what your take on claims that it is linked to so-called COVID-19 vaccines. Do you believe there is a link between these two?
Yeah, I think it's not an issue of belief, Frosty. It's actually an issue of fact. I mean, the published literature is very clear on that now. And in terms of the best available evidence we have, in terms of the highest prevalence of myocarditis, inflammation of the heart muscle occurring, comes from Hong Kong, and in people who were in early adulthood or late teens. That prevalence that was attributed to the COVID mRNA vaccines was about 1 in 2,700, which is not a small figure. So it does exist. Of course, people are going to also ask the question about whether COVID causes myocarditis, and it can do. But actually, if you look at the overall evidence and from my own clinical experience, there doesn't seem to be any increased prevalence of COVID myocarditis in relation to any other virus. Myocarditis has been around for a very, very long time. My own brother, sadly, when I was 11 years old, my older brother, who was 13, he died of viral myocarditis, and it can be fatal. I think that with the vaccine, certainly in the short term, although it can be problematic, it doesn't appear to be as lethal as, say, viral myocarditis. But I think that sort of detracts from the issue, is that any kind of myocarditis can potentially set people up for problems in the future, especially if there is permanent scar. So it is a problem. It is an issue. It may well be one of the explanations for sudden cardiac death in younger people during sport, that people have not been aware that they have had some inflammation of the heart muscle. There's been a small scar. They, within a few weeks of having had the vaccine, they have done some, rigorous physical activity, and that has triggered an arrhythmia, which has caused a cardiac arrest. So I think there's very good evidence to at least suggest that is a likely cause of some of these sudden cardiac deaths.
Very good evidence that it's likely, but those who disagree with you would say that the myocarditis is stemming from the virus itself, but not the vaccines.
Well, in everything, in Frosty, it's not about disagreeing. It's about the individual case and the case history. So, in medicine, when you make a diagnosis, 80% of your diagnosis comes from the history in an individual. That means the story of that patient. What is their background? When did they have the vaccine? When did they experience problems? So you can make medicine is very much the art of probabilities. That's how you make diagnosis. Having said that, there is separate good hard evidence now from autopsy studies that reveal that, approximately 70% of people who died within a few weeks of having had the vaccine, when there was autopsy studies done, it was very clear from the autopsy categorically that the vaccine had caused their deaths. And that's because of special staining techniques that can actually detect spike protein from the vaccine in the myocardium, in the heart muscle, and in the coronary arteries. So that is without any question. That's not a speculation. That is not a likelihood. That is hard evidence.